Hi everybody, back, and we're going to be talking about muscles and tendons. We talked about this last Saturday, but I'm going to give you a little review. Remember that muscles are determined by varying forces acting across your joints. I'm on page 51 in the study guide. These forces are produced by muscles, and their effect on body position are determined by origin, insertion, and the muscle shape. Terms used in muscle speak that I do want you to remember, right, is the prime mover or the protagonist, the muscle group that's primarily working, the antagonist, the opposite muscle that's working, and the synergist, those muscles that help the movement happen. Remember that tendons attach muscle to bone. That's very important. And ligaments attach bone to bone, right? Okay. On page 54, the group of muscles that I want you to look on Frank and find. On your exam, I'm going to have a list of muscles on the bottom of Frank, and you're going to have to find those muscles on Frank. So I want you to get familiar with these muscles on page 54. Your sternocleidomastoid, the muscles in your neck. Trapezius, the muscles right up on here. These big muscles on the top of your shoulder. Deltoid, shoulder, we have an anterior and a posterior deltoid. Pectoralis major and minor, your chest muscles. Biceps brachii, your bicep, and the opposite right underneath that is your tricep. Serratus anterior are these muscles that come right from underneath your rib cage, right? These beautiful fingers. Linea alba is not a muscle, it's a ligament, but it crosses down the central line of the body. I like to call it the midline of our body. It's called the linea alba. All our abdominal muscles, the rectus abdominis, internal and external obliques, and your transverse abdominis, or your TVA. Tensor fasciolata is fascia that's on the side of the leg. Sartorius is a muscle that runs inside the leg, so it's an inner thigh muscle. The quadricep muscles are a group of 4 muscles, right? And hence quad. So we have our rectus femoris, which is the biggest head. Then we have the vastus medialis, vastus intermedialis, and the vastus lateralis. So we have 4 big muscle groups that are in our quadriceps. Our gastrocnemius is our calf muscle. Tibialis anterior is about where your shin is. Your soleus is where your calf is, a little bit above it. Infraspinatus, supraspinatus, subscapularis, teres minor, and teres major. I can't show you, but they're all inside our rotator cuffs. This is going to help externally rotate, internally rotate, abduct, adduct your shoulder joint. Your latissimus dorsi are the muscles in the back of the body. Our gluteus maximus and minimus. Yeah, some of us have maximus, some have minimus, but it's our glute muscles. Hamstring muscles, right? We have the bicep femoris, semitendinous, and semimembranous. So your hamstring muscles have 3 heads to them. Adductors, anything with ADD, ductor, it means they're inner thigh muscles. Anything that's abductor is going to be an outer thigh muscle. Adduction to bring in, abduction to go away from the midline. Your iliotibial tract is also connective tissue that runs on the outside of the leg. Your Achilles tendon, of course, is on the right by the ankle of your leg. On page 55, yes, there's a little bit more explanation about your hamstring muscles. Number 11, 12, and 13 will tell you the names of those hamstring muscles. Learn them. They're really important. They will be on your exam. Namaste.